This is Bill Keegan, Town Manager in Foxboro, with your latest COVID-19 update. So I apologize for the delay this morning. I was actually in another meeting and that ran a little bit late, so I apologize for getting on a little bit later this morning than normal. But here are the latest numbers. Haven't changed anything from last night. I provided an update to the Board of Selectmen at their meeting at about 7 o'clock last night. And total positive cases in Foxboro since March 15th are 45. Total recovered are 22. Total current positive cases 23. Total of 318 people have tested negative since the beginning of the COVID-19 epidemic here in Foxboro. On the statewide level, there are 28,163 cases currently active in Massachusetts. 126,551 have been tested. And in terms of the percentage of positives, there are a total of 22.3% of the population that has been tested have tested positive. So that is that's the latest new statistic that they've come out with. Total of 957 deaths statewide based upon COVID-19 related complications. So taking a look at the county-wide information, Norfolk County has 2,969 cases, a total of 125 deaths in total. And taking a look at this from a broader perspective, it looks like that Suffolk County and Middlesex County, the two big counties, actually Middlesex County leads the state in terms of number of cases with 6,254 cases. Suffolk County has 5,872 cases, 120 deaths, and going back to Middlesex, 188 deaths associated with cases in that county. So that is the latest information in terms of statistics. In terms of, there's a new statistic that's come out in terms of the overall impact. There is a 3.4% fatality rate associated with the epidemic here in Massachusetts. The age group that is affected the most is actually the age group between 80 and 89. 347 people have died in that age bracket associated with the COVID-19 impact. And the next highest group is actually, there are two groups that are relatively high. 225 on the over 90 bracket, as well as 70 to 79 age group. There is 238. From 60 to 69 there were 96. 50 to 59 there were 40, and it goes down from there. 40 to 49 to 5, and 30 to 39 there were 6. And there are no deaths below the age of 30 anywhere in the state based upon the statistics that we currently have. So that's an interesting new piece of information that we can provide for you today. Let's take a look at what the report has for today. Bear with me 1 second here. I'm trying to get this report up for you. Okay. On Tuesday, alerts MA at 888-777 remind residents of Massachusetts, if you feel COVID-19 symptoms, stay home to avoid exposing others. Check your symptoms and connect to telehealth, and that can be at buoy.com/MASS. Governor Baker spoke from Joint Base Cape Cod on Tuesday, where a 94-bed field medical hospital was stood up in just 6 days, which is extraordinary in many ways. The governor stated that there have been over 122,000 COVID-19 tests, and there are 28 sites operating statewide at this point. It was announced that starting on April 14th, daily inventories of personal protective equipment will be posted on the state's website, as well as the daily dashboard of hospital capacity. During a conference call with the Massachusetts Department of Public Health, it was shared that 1,900 volunteers are helping local boards of health with the tracing of people who have been in contact with positive COVID-19 cases as part of the Community Tracing Collaborative of the CTC. And then just from the MRC email, the Massachusetts hospital bed capacity for the large surge currently sits at 15,900 ICU and non-ICU beds. As of April 12, 50% of the beds are available statewide, including 40% of the beds in the Metro West region. The Department of Public Health has released update guidance on protective measures for non-healthcare essential workers who may have had exposure to the COVID-19 positive individuals, but who may remain asymptomatic. MEMA, together with the Massachusetts National Guard and the Cape Cod Hospital, has opened a 94-bed facility on the Guard's Joint Force Base in Bourne. The facility, which will provide exclusively COVID-19 care, was made operational in less than a week. The state continues to track, inventory, and distribute protective personal equipment to healthcare providers on the frontline responders, where the distribution totals over 3 million. Healthcare professionals and others with area expertise looking to contribute to the fight against COVID-19, either by volunteering or applying for COVID-19 specific work, can now join the search for opportunities at one location, and that's mass.gov/join-COVID-team, all one word. Small business and manufacturing. The U.S. Small Business Administration reports that there have been over 941,000 applications for the Paycheck Protection Program, approved totaling over $228 billion through nearly 4,600 lending institutions throughout the country. They have also released an updated FAQ line containing new questions and answers that have been raised throughout the process. And businesses which have the ability to transition operations into production of PPE and other equipment should review the Massachusetts Emergency Response Team, MERT, at mass-ERT website for program information and grant opportunities. And unemployment assistance. The Department of Unemployment Assistance has announced that the new UA application portal for self-employed and 1099 employees will be ready by April 30th. Requested guidance on what information will be required of applicants prior to the date has been requested, so that people are able to prepare for their filing. In response to Speaker DeLeo's request for a multilingual portal of unemployment insurance applications, the Department of Unemployment Assistance has released a Spanish language mobile-friendly application form. The department has also announced that it plans to release applications in Portuguese, Haitian Creole, Chinese, Vietnamese, and additional languages in the coming days. Legislation and budget. Today, the Joint Committee on Ways and Means, along with the administration, participated in an economic roundtable designed to provide information to the legislature on possible impacts on the pandemic on the state budget. Legislation has been filed to require the administration to disclose more statistics and information about the impact of COVID-19 on nursing homes. The bill will be heard virtually on Thursday, April 16th. That's tomorrow at 1:30 p.m. Legislation has been filed to decrease the number of signatures candidates need for U.S. Congress and U.S. Senate that are required to submit in order to get on the ballot for September's primary and the general election in November. The bill is currently under consideration by the state Senate. In the food resources, the Department of Transitional Assistance, along with the Department of Elementary and Secondary Education, are working to administer the pandemic EBT program authorized through federal legislation. The EBT cards will be used issued to children eligible for free or reduced price meals, including those whose families are not SNAP households. The Department of Agricultural Resources has dedicated COVID-19 page with buy local resources, including a statewide map of farm locations that remain open for business. And the Massachusetts Farmers Market Association provides a list of food delivery services from local farmers for those wishing to continue purchasing local produce without traveling to a farmer's market. That's actually a new piece of information that's actually quite interesting. And let me just say that again, the Massachusetts Farmers Market Association provides a list of food delivery services from local farmers for those wishing to continue purchasing local produce without traveling to a farmer's market. You can actually go to the town's website, on the Board of Health's website, and that will provide you with further details on how you can get that information directly through the Board of Health. And we see resource for residents experiencing job loss or loss of income. So we know that the new guidance, there is new guidance on unemployment assistance. There are a number of state resources and supports available to support workers who may find themselves unemployed or otherwise income constrained during this uncertain time. The federal pandemic unemployment compensation, additional $600 per week for those collecting unemployment for all weeks from March 29th to July 31st. This is something that we've had in the email before, so no changes in that at this time. I was informed as of yesterday that some of those checks are actually starting to go out. Those who paid their taxes through and had direct deposit associated with their cases, can actually have the money. Well, the money will be deposited directly into their account. Those that did not will have checks sent to them, but it will take about 2 or 3 weeks longer to receive those checks from what I'm told. So we'll have to wait and see if that actually improves over the course of time. Nothing new really that's already been said about what's been going on the unemployment side that hasn't already been reported. So that's the latest information from the state and from what's been going on around the Commonwealth and impacts and on the federal level as well. So hopefully that's helpful to those who are listening in this morning. Last night I reported to the Board of Selectmen the latest updates on what's been happening locally. There are a lot of great things going on in Foxboro, associated in many different levels. We still have programs being done through the Recreation Department. School is being done online. The Public Works Department is still doing its work out there trying to maintain fields and actually did a tremendous job of cleaning up after the storm the other night. Police and fire, it goes without saying, are doing a tremendous job for the community, and dispatch as well. And all public safety are the heroes in this operation right now, and along with all the great efforts that are being put forth by the town's employees and trying to maintain the services the best we can given difficult circumstances for all of us. So certainly we want to hear from you if you have something that you need. I know that yesterday was a little bit of a challenge, so that power was not. Some people lost power in town. There was about 600 people lost power associated with the storm the night before. We were able to get power back, restored by about just be shy of 2 o'clock yesterday afternoon for nearly everyone in town. There was maybe a few outliers that still needed, based upon services being ripped from their houses or whatever the case may be, that were much more significant in terms of more personal type of attention that was required. But having said that, generally the town was back up and running by about 2 o'clock yesterday afternoon. So we're grateful to the efforts of National Grid to restore power here as quickly as possible. And it's important to remember that the reason why there was a delay in getting some of those repairs done was because the winds were so high the night before that it didn't allow the line workers to get up in the buckets, because if anything higher than 35 miles an hour does not allow them to get up and use the equipment they need to get to do the repairs. So that delayed things a little bit, so they couldn't really get in and start repairs until after 9 o'clock the night before. And some of those repairs were extensive based upon the damage that occurred through the amount of 60 to 70 mile an hour winds that occurred. And in certain areas of town were affected more significantly than others. So that's the reason why that was delayed a little bit. But having said that, I think they did a pretty remarkable job of getting the power back as soon as possible under the circumstances. So that's the latest. If there's anything that you need, feel free to email me at wkeegan@foxboroma.gov. I'll be happy to put it out there. Also, I'm tracking emails from folks, so I will continue to track your comments as well, and certainly I can. And if I appreciate any questions you have, and we'll certainly try and respond to them. If I don't get to them today, I'll certainly get to them for the next broadcast. But having said that, that's the latest information we have. Again, I apologize for the delay in getting to you today, but hope everything's going well with all of everybody. And I just had a comical piece sent from one of my friends at the senior center who asked, where am I getting my haircut? And the answer is at home. There is no haircuts going on right now, and actually I had my son here cut my haircut the other night. But I could actually use another one. I can't wait for my barber to come back online, actually. But thank you for mentioning that. So good little bit of comic relief for that. So hope everybody's staying well. Stay healthy, and I'll catch you next time. I'll be here back hopefully around 10 o'clock tomorrow morning, and hope everybody stay well. We'll be back in touch with you soon. Take care now.